November for many means Movember, a month known for putting an increased spotlight on prostate and testicular cancer. But it's also a good time to talk about a topic that can also sometimes be considered taboo, and that's men's fertility.
And here to tell us more about this often overlooked aspect of men's health is fertility doctor, Dr. Marjorie Dixon. Dr. Dixon, good morning.
Good morning.
Nice to see you. Let's start with maybe just what are the biggest myths when it comes to men's fertility?
Well, in as much as men's fertility is concerned, is that it's an issue. That's a big myth. A lot of people think that infertility is just a female issue, but 50% of the time it's a male issue. So that can't be discounted. Okay?
And to that point, let's talk some numbers and statistics.
Yep.
1 in 6 Canadian couples face fertility concerns, with male factors contributing to nearly half of these
50%,
cases.
50% of the time. So when I see a patient that comes in and says, a female patient, who will say, I just want you to work me up first. And then if there's something wrong, if there's nothing wrong, then we can go find my partner. Well, I say, well, I'm missing 50% of my data. How am I supposed to come up with an appropriate therapeutic plan for you? So we can't discount the importance of assessing a man's fertility. So that's a big myth.
Mm-hmm. Yeah, let's expand on that a little more. Let's talk, if we could, about the importance of seeing someone such as yourself, a fertility expert, early and getting some early testing.
Yeah, so the earlier you do it, the more I have in my toolkit to help. And so particularly for men who, when they were a child, for example, had a surgery for cryptorchidism, so not all testicles descend into the scrotums. Men know that they've had that surgery sometimes. Or if they were little and they were told that they have a genetic difference, Klinefelter syndrome, for example. Those are things that the sooner we see patients for, the more that we can do. So early assessment through a sperm test or a semen analysis actually gives a lot of information for what we can do therapeutically and then help from a fertility perspective.
So these assessments, how many, so you treat the couple the couple initially together, and you go through how many different assessments?
So what happens is I see the couple together generally, in as much as the male is concerned, because I often start with the female, in as much as the male is concerned, because we're talking about male fertility, I try to debunk the myths. So one of them is that I can make a baby at any point as I get older. Not true. Age affects male fertility, just like we know age affects female fertility. And much as testicles are sperm production factories, when men are past the age of 45, the quality and the caliber of sperm changes. And then also we know that certain genetic and problems that we have medically are higher after the age of 45 in male offspring of men over 45. So there's a higher rate of schizophrenia, for example. So that's another myth. So men think if I'm older, it doesn't matter, I can still make a baby. Maybe you can, but there are still deficiencies that need to be assessed.
Mm-hmm. I mean, this is such a big and important conversation. Why do you believe male fertility is something that is generally not talked about?
I think just because there's that myth that as long as I'm ejaculating in the way of an okay egg, I can make a baby. And actually, one thing that needs to be dispelled is that just because you're ejaculating or you say that you have semen, doesn't mean there's anything in it. So what comes out of semen is the sperm cells, but then there's also just a lot of fluid that serves the purpose of getting the sperm to the egg. So just because you see semen doesn't mean that you're making sperm. And so there's this idea that if I can get an erection and I can ejaculate and I see all the people in Hollywood making babies into their 90s, then I shouldn't have a problem. But the reality is that 50% of male factor, 50% of infertility is attributable to male factor infertility and needs to be worked up. And there are things we can do. The problems can be pre-testicular, testicular, part of the testicle, or post-testicular. Sometimes there's a blockage or an obstruction. So that can be fixed. Sometimes you need to stick a needle into a testicle to extract the sperm to use for things like in vitro fertilization. But there is a lot that we can do as fertility specialists for male factor infertility. And in fact, lifestyle things we see also having had a significant impact over the last decades. In 1940, the average semen sample was about 122 million per milliliter. Segue to 1990, we're down to about 66 million per milliliter. So
and
it's
that's
gone
all
down.
Due to lifestyle, what we're consuming, what we're eating?
Environment.
Yeah, so we believe that there's some environmental things. It might also be the way we were measuring it a long time ago is a little different than when we were measuring it now. There's that. But there are a lot of environmental things that men aren't aware have an impact on sperm, like marijuana. We've legalized marijuana in Canada. That's had a tremendous impact in what I see. Because what it does to calm people, it does to sperm. So sperm becomes less motile. less potent. And when you're thinking about semen parameters, the important things that sperm need to do, they need to swim, they need to be able to fertilize, so they need to be nicely shaped, and there needs to be a good amount of it. And lifestyle habits can impact all of those things. So men that have been treated for testicular cancer with chemotherapy or radiation will have much lower quantities of sperm. Yeah.
Enlightening information, but it begins here. It begins talking about it, right?
Yes, yes.
All right. Dr. Dixon, thank you so much for coming in.
It's a pleasure.